FM.
All right, top of the afternoon to you. Sunday, 28th of January, 2024. If you had any doubts that you'd crossed over, he is making it happen, right? Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Listen every Sunday, 2:05, we come alive by his grace, of course. And we say if it bothers your health or well-being, we'll definitely talk about it. Today we're talking about cervical cancer. Let me take some praise from Amerado, and Famia. I just figured out the pim 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 part of this song, Quite happy with myself. Stick and stay.
I strive for my family. I'm a soldier, one man soldier.
Wow, I find I can give praise with any song, right?
I'm a soldier.
In all things, give praise. Colorado and Famia, huh? And I know some of you are going to link it with but I won't mind you. I won't go there. Right, we're talking about cervical cancer. Second leading cancer when it comes to women.
You know he's another.
Ghana has about 10.6 million women between the ages of 15 and 44 at risk of developing cervical cancer. Current estimates say that every year, that's annually, 2,797 women are diagnosed, and sadly, folks, we lose almost 1,700. 1,669 women die of cervical cancer every year. So we're focusing on that. In the studio, I have a slippery sweetheart of mine. Rose Edufu is Principal Nursing Officer with the Reproductive Health and Family Planning Unit of the Kolebu Teaching Hospital. Hey, Rose. Akwaba. Akwaba.
Yeah.
But you're most welcome. Yeah. It's been ages,
Sure.
Looking good as always.
Oh, thank you.
Continue to lead me into temptation.
Oh, you couldn't have said that here.
I know the way. Oh, but temptation to bring you into the studio
me here. I
to
know,
educate
right?
and extend
I know,
your
right?
expertise.
I know, right? Because seriously, when you called me, I was so excited. I was like, this year we haven't spoken, and I've not had opportunity to come here. So
But
I'm
I know
excited.
you guys are working so hard
You know,
in
right?
all the units I reach out to resource this program. So I'm so grateful that you agreed at last minute, right? So it's good to have you.
Same
Another
here.
year is upon us. Another cervical cancer month.
Sure.
What have you guys been doing in Kolebu?
Okay, so I think good afternoon to our cherished listeners, and once again, I'm excited that we're going to talk about cervical cancer and its related issues.
Right.
For us, usually January becomes the advocacy month.
Okay.
And then because it can be a bit stressful combining with the regular activities
Right.
in the office, so we try to do talk across corners from media platforms to the other institutions, and then in February we usually start our screening. So currently what we have on our bill, we have a webinar coming off on Wednesday.
Yeah,
Sure,
31st.
it's going to be an awesome session. I
Right.
know.
Can anybody hook up? Can anybody
Sure.
log
So
in?
that we really want everybody to.
Okay,
as
you shared
many as
the
possible.
details, the password, and everything with me. So I'll make sure Abeku shares that as well.
That is great.
All right.
That is great. I'll do
Okay.
that. And then from February 5th, we're going to start with our reduced cost screening.
Right.
Because, yes, usually the cost of screening can be a deterrent to some women.
Right.
And so they wish they could screen, but
To a lot of women.
A lot of women, that is it. So around this period, our partners, especially the laboratory partners, are able to assist us with some level of support, so that we can highly discount our services to aid a lot of women to screen. And so we're going to have the HPV DNA with the pap smear, usually a combined test, which currently goes for 320, will go for 220. And then the liquid-based cytology sampling it is 170, but it will go for 100 Ghana cedis.
Right. So
it's going to run for 3 months.
Discounted screening and testing for 3 months.
For 3 good months.
Well,
it's only reproductive health that does that. And you know, we always run unique services.
Right. But you know, I always emphasize, listeners, that, don't wait for a discount. We're talking serious stuff.
Exactly.
Right? Losing 1,700 women every year through this type of cancer is serious. So let's get to it. What is cervical cancer?
Okay,
Rose?
So thank you once again. And I know we have heard a lot, but just to simplify it enough for us to appreciate, we would first have to look at the female reproductive organ briefly, and then starting from the external genitalia.
Right.
We know we have the vulva there. And then when we go into the area that we call vagina, we have it there. And a lot of the times, maybe because I'm going to deal with 2 streams of gender, the female, the male, with the female, we can appreciate our own structure.
Go straight ahead.
But
you know, we have discerning listeners. This is just an intro so that we get into
Great.
Okay.
So we have, when we say the cervical cancer, then it means that it is a cancer that affects the mouth of the womb, or the part that we call the cervix. And it is after the cervix or the woman has been exposed to a virus known as the human papilloma virus.
The HPV.
The HPV virus.
Right.
That is what would contributes to the cause of the cervical cancer. And it is not just immediately after the woman is exposed to the virus that she gets the cancer. It could go a transitional period for as long as 10 to 15 years.
Right.
And so one could get exposed today, she may not have anything until like 10, 15 years later before she begins to see some signs that indicates that possibly she could be having cervical cancer.
Right. So a woman gets infected
with the human papilloma
with the
virus.
HPV virus,
sure, which is sexually
quite
transmitted.
commonly, should I say, what? I don't want to use available, but it's a common virus.
Exactly.
And it is sexually transmitted
sure.
primarily, or?
Exactly.
Right.
Exactly.
So anybody who is sexually active is already
highly at risk of getting cervical cancer.
Right.
Sure.
Any woman who is sexually active.
Any woman who is sexually. And you know, a lot of times we don't even talk about sexually active because we want to talk about sexual exposure. Maybe, yes, you may not be sexually active, but like 10 years ago, you got exposed sexually. So that means alone puts you at risk, even if you've had it once in your lifetime.
Right.
The fact that there has been that communication,
right,
you have a chance of possibly getting that risk.
I know some of you are goody two shoes and you're going to say, well, I haven't done anything or did it. Well,
The others will come.
There are many types of sexual activity that could expose you to HPV, the virus that is primarily responsible for cervical cancer, which I'm discussing with Rose Edufo of the Kolebu Teaching Hospital Reproductive Health and Family Planning Unit or Center, right?
Exactly.
Very serious business here. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone lines. Oye Nafienya, I see you welcoming me into your home. Always on point, right? So you're welcome, and we're going to be learning about this. Okay, risk factors, right? We've talked about sexual or exposure to sexual activity.
Exactly.
Right? Which may, lead to you getting infected with HPV.
That's it.
Right. Anything else?
Okay. The other one has to do with early sexual debut or special exposure.
Right.
So when you say that, research indicates that people who started sex quite early, let's say in their adolescence, they have about 3 times chance of developing cervical cancer.
Early onset of sexual
activity.
Right.
About 3 times chance of developing cervical cancer.
Okay.
Then the other one has to do with family history. And so we're looking at maybe if your mother, an auntie ever had cervical cancer or any of those cancers, it equally puts you at risk of getting cervical cancer.
Okay.
Then we're also looking at the fact that a woman might have had a particular cancer that is related to the HPVs, the other HPVs.
Right.
So it can be anal cancer, it can be a vaginal cancer. The fact that you have ever had it and it is the same virus,
right,
then it equally puts you again at risk of it. And then the other one has to do with, for instance, for men, a woman who had ever had a partner, losing a partner to cervical cancer.
Right.
Because after all, when it comes to looking at our cultural environment,
men who have lost a partner
to cervical cancer,
sometimes
they could also carry the virus and then they could give to others. But that notwithstanding, a lot of the times those ones are very slim chances. And then we are talking about uncircumcised penis to say, because we said it is sexually transmitted. And so for as long as the man could collect those microorganisms or the viruses and then transmit to the other woman, there's a chance that the woman who gets such engagement with such a partner also could get the cervical cancer.
Okay.
And so basically these sexual related and then family histories and then the exposures can readily expose one to getting cervical cancer easily.
Risk factors. Know your partner. And
then multiple sexual partners. That I cannot say.
Casual.
Sexual, yes. And a lot of the times when I'm talking about multiple sexual partners, it's not just about like the woman I am engaged to or have a relationship with Kojo, Kwame, and then Kwesi. But sometimes it could be that like, yes, it is only my husband I know, but is my husband also saying I'm the only one he knows?
All right.
Or that's the only partner I have?
How many polling stations and constituencies are open?
Thank you very much. So he goes to
your awareness or knowledge. So we're looking at your risk profile. We're not passing judgment.
Sure.
We're talking about cervical cancer, but we're trying to establish and identify things that brings it closer home.
Perfect.
Okay?
Perfect.
You could be a deacon, you could be a psychologist, you could be a, right? So
Exactly.
Rose is helping me identify and explain this risk profile.
Very necessary.
Right? Early onset of sex, family history, there should be some genetics there. Multiple partners, be they serial monogamy or polygamy or just, right. Let's get that straight. If you have any questions, let's understand this. Okay. So men can pick up the HPV from women and women can pick up the HPV virus from men.
Exactly.
Okay. But we are putting the HPV in the witness stand, right?
Perfect.
As the accused.
Right.
And now, Rose, we understand that there are particular strains of the HPV that are more likely to lead to cervical cancer.
Exactly.
Right. So let me ask, so is there a test to identify whether I've been exposed to HPV? My understanding is that typically our bodies and our immune systems can deal with HPV.
Sure.
Right? Is there anything...
To an extent.
To an extent, yeah.
Yeah.
Right. Is there anything that can conclusively identify who's been exposed to HPV?
Okay. So before we talk about the testing or the conclusive aspect of it, usually the HPVs, it's over 150 strains of them that we have.
Okay.
And it is just about the type 16, type 18, contributing to about almost 70% to cervical cancer causation.
Okay.
And then there is another types that could contribute to like the rest 30%.
Okay.
The type 11 and the 6 usually contributes to the genital warts, like sometimes some young ladies or gents will see on their penis and then around the vagina
genital
area.
warts.
The genital warts, sure.
Right.
So the type 16 and the type 6 and 11 could contribute to that. And so a lot of the times when one gets exposed to the virus, it will be very difficult to say that just at a glance or at a look, you could see that this person has or the virus.
Okay.
So what is done is we have the HPV testing or the screening.
Okay.
So previously, when we started the screening, we were doing the visual inspection with acetic acid on the cervix.
Okay.
It was not really identifying or isolating the HPVs. But now there are lots of tests that you could
that one isolates, abnormal
the pre-cancer
cells
lesions on the cervix.
Okay.
Yes.
Acetic acid being vinegar.
The vinegar, sure. And that is the less expensive screening test that one can do.
Okay.
But currently, there are a lot of them. Either the self-test sampling, you use a swab stick to take the sample, or we have the other one we call the HPV DNA, where we use a liquid-based sample.
Okay.
So at the facility, they'll take the sample by sweeping on the cervix or the mouth of the womb, washing the reagents, and then it goes to the lab for reading.
Okay.
Or maybe where it is self-sampling test, it is the woman who goes to take the sample at home. She brings it or arranged per the institutional protocol to have it to the lab, and it is read so that we can identify which strains are prevailing, because we have the low risk strains and then the high risk. If it is a low risk, there is nothing much to be worried, but we still would need to find out, is it the 6 or the 11 that could even lead to the other words that I mentioned, or it is the high risk that we had to be very worried about. And again, with the high risk, we need to find out, is it the type 16, is it the type 18, or the other ones. So it is very necessary to really assess to know which risk the woman may be carrying. And then that even makes it more interesting, that it helps us to identify if there is any intervention to offer. We are able to do that immediately
promptly,
before we talk about pre-cancer cells lesions on the cervix, and then advancing to cervical cancer. Sure.
24 minutes past the hour of 2 on Joy 99.7 FM with me, Nortey by Nature. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, we make it our objective, our mission, our plan, our design, to discuss all the things that can affect, impact, compromise your health and your well-being. Today we're looking at cervical cancer, and I have in the studio with me a slippery sweetheart of mine, Rose Edufu. Leave that part out there. But she's a principal nursing officer with the Reproductive Health and Family Planning Unit of the Kolebu Teaching Hospital, sharing with us. We're going into detail, right? And we're doing all the analysis that you need. I see Dede in Maryland already typing oral sex.
Oh, Dede,
my
friend.
Hey, another slippery sweetheart. Dede is typing and asking about oral sex. Can it cause cervical cancer? Yeah. And I think there's a bit more. I'll read those in a second there. So if you have any questions, concerns, I'll pass them to Rose. Indeed, you are the reason I brought her. Leave me out of it, okay? So, we've got to understand these things, all right?
Sure.
I'm sure you answered the one about oral sex, right?
Sure.
But let's also quickly rope in and get an understanding of telltale signs, possible flags, or signs and symptoms, okay?
Right.
Which we are not saying or insisting on or asserting are conclusive.
Perfect.
Right? But the kind of things that may or should alert me, a woman, or even my partner.
Okay, great. So I'm excited about the conclusive bits that it does not mean that when you see any of these, I have cervical cancer. No.
Right, no.
That notwithstanding, I want to emphasize the fact that yes, the transitional period can be very long.
Okay.
But in some women, it could be as short as you can imagine, depending on the immune system. And so even to AIDS, those who have immunocompressed conditions, like compromised conditions like HIV, they have about 6 times chance of developing cervical cancer. And so then what we're trying to say is that with the signs and symptoms, the number one that I want us to notice abnormal vaginal bleeding.
Abnormal vaginal bleeding.
So explaining that it could be like for us who are in our regular menstrual age period, reproductive age, we see our periods, the number of days you are expected to have it. But if for any reason it is abnormally prolonged, we need to find out.
Okay.
You're not supposed to have sex during or after, not supposed to bleed during or after sex.
Okay.
But if for any reason you notice that you are having post-coital bleeding, like bleeding after sex or during intercourse, we have to also be mindful. And then maybe you could be menopausal.
Right.
When you go menopause, don't expect to come back to join those in the reproductive age. And so if you're seeing abnormal vaginal bleeding around this age, so we need to also be cautious of what exactly could be. But like I'm saying, all these abnormal bleedings could also
be for other reasons,
other conditions. So never think it is only cervical cancer. And then the other one has to do with very offensive vaginal discharge. This is not a discharge, offensive nature.
Vaginal. I'm going to ask you, sweetheart, I'm going to ask you to slow down a bit. Very offensive vaginal discharge.
Yeah, sure.
Okay.
Sure.
Now, some people, we've done this before with you, and I'm missing the ladies already.
Right.
Doris and
I have missed them all.
Teresa and
right.
Sure. But when you say vaginal discharge, right, especially with relation or in relation to cervical cancer.
Okay.
Yeah, let's go back. Vaginal discharge.
Sure.
We've done abnormal bleeding. Now we're doing
abnormal vaginal discharge.
Okay.
So it's abnormal because for us as women, you're supposed to have some extent of a vaginal discharge because there's a gland that actually lubricates the area.
Okay.
And so that one is not offensive.
There is normal discharge.
Yes, it's normal.
Okay.
It's not offensive, nor itchy, nor discolored.
Okay.
But this particular one, it's really offensive.
Okay.
Not a fishy type of smell. It is a terrible, it can be a terrible odor.
Right.
And then the color sometimes can be like bloody stains inclusive because of the bleeding that you already experiencing.
Okay.
And so sometimes you could have some level of blood within, or not really a hidden or occult blood to say, but it could be quite an obvious blood within the discharge. And then again, so it makes the color a bit undefined. You're not able to really say that this discharge is bloody or it is dark brown in color, but you can really see that there is a great deviation from the normal. And then you may not experience the itchiness because it's not just a bacterial infection. This is a viral condition. And it's already eating up an aspect of the mouth of the womb. And so it gives you that kind of discomfort. And then apart from that discharge, sometimes it would compel you to use panty liner cannot be able to save situations. It is like using a sanitary towel or any other comfortable thing that the woman would prefer to use to collect or receive those discharge. So that is that abnormal vaginal discharge. And then with time, because there is already some kind of bleeding, the woman could also lose blood because most often there is a kind of a sore developing on the mouth of the womb. And so this is also increased in it increases the level at which you frequently bleed. And that may reduce your HB level or your blood volume level.
We're talking anemia here?
Sure. You could easily get anemia a lot of the times. And then the other part has to do with, remember, the uterus is, if you had to look at the position of the uterus, in front of it we have the bladder, behind it we have the rectum. And so because the structure within these two organs is being affected. With time, it affects both organs.
It impinges,
and so
compromises those two organs.
Perfect. And so apart from pain that you could have, whether sex or no sex, like whether you're having sex or not doing sex, you could also have severe lower abdominal pain.
Right.
And that could also radiate into sometimes even the bladder wall, so that it affects you during the time of urination or producing urine. And then it could also, when it advances, also affects the rectal area. It goes with time. I want to use this unfortunate incident in our country now, with the issue of the galamsey. You notice that the contaminated water is coming from a very far end.
All right.
But those who are living downstream are equally seeing the effects of what has been done there. It is the same thing. You know, the blood in us, it's moving from one part of the body to the other. Because there is a cancer cell that has affected one part of the body.
Right.
If it does not intervene early enough, it affects the bloodstream, and then whichever organ it gets to, if it gets to the lung, apart from your cervical cancer, it will give you a lung cancer.
Right.
If it gets to whichever parts of the body, you get those effects. And so these are basically the signs that you see. But that notwithstanding, a lot of the times from the beginning, you don't have any sign.
Can be asymptomatic. By the time
it's symptom-free.
Silent trouble.
Exactly. By the time you begin seeing these ones, it means that things are escalating, and we need to intervene immediately.
Right.
So don't wait to see any of the signs before you come. And that's why we're saying cervical cancer is the only preventable cancer.
Right.
Why wait till you see symptoms or signs when it can easily be identified, truncated at every point of the course before you get a cervical cancer?
Whoa, Rose, you need a rest, right? Let me read a couple of WhatsApp messages. Good afternoon, enjoying the discourse already. Kindly ask your guests what effect fingering has as part of foreplay activities on the lady. Are you talking about cervical cancer, or you want her to talk about fingering, which, you know, it's another territory altogether? Steve from Somanya sends that, okay? I thought he was going in the direction of whether it can introduce the virus and so on and so forth. But
so maybe we'll pick it from that
angle. Effect of fingering on the lady. Okay, note that, Rose, for me.
Sure.
Let's see. This one says, hello, Nortey, good afternoon. So recently, where is it? Recently, I observed some blisters around my genitals, which I asked the doctor and was diagnosed with herpes. This was treated and those blisters are healed. However, I read a little about it and I learned it doesn't really have a cure, right? May I please know if this exposure could lead me to attracting or getting infected with HPV too, or is it HPV I was diagnosed with? So essentially, is HPV the same as herpes, right? He's been diagnosed with, I'm saying he, right? Is there a name? Okay. This person has been diagnosed with herpes, was treated, and was told they had been cured. But he's read, or she's read, that there's no cure. Hang on to that one. Good afternoon, Nortey. Please, I had my womb removed 2 years ago. Am I still at risk of developing cervical cancer? Do add your names. I love to develop a relationship. But thanks for sharing. This is from Dede in Maryland. Okay. She says she's the one about oral sex.
The oral sex.
Okay. Parents here are encouraged, that's in the US, to have their kids between age 9 to 15 vaccinated against cervical cancer. We'll get to that. Why that particular age range? Right? Because they become or have become sexually active? Why can't older folks be vaccinated? A good question which comes up very often. So this is the homework for Rose. Let me see this anymore. Let me just clear them and then come back. Okay, Judith is the one who asked about, she'd had the hysterectomy and she's asking if she's still vulnerable to cervical cancer. She had her womb removed, and you're talking about part of the womb. So,
sure.
yeah. All right, let's deal with Judith's question.
Okay.
As quickly as we can.
Sure.
Then, yeah.
So thank you. So with Judith, maybe what we need to find out was what led to the womb getting removed.
So why the hysterectomy?
Why the hysterectomy?
Okay.
Because a lot of the times, or let me say sometimes, there could be some pre-cancer lesions that may be identified.
Okay.
In assessing it, the safest is to remove the womb and the other structures around it.
Okay.
Because it's one of the interventions that can be used to prevent cervical cancer. But that notwithstanding, if she has even removed the womb on grounds of other reasons.
She sent something which says due to fibroids.
Okay. On the grounds of other reasons, we have what we call the vaginal vaults.
Okay.
We mentioned that the cervix is a small structure between the end of the vagina and then the mouth of the womb.
Okay.
And so that path between the two structures,
that canal,
that canal is what we are talking about. So we have already removed the mouth of the womb. However, there is what we call the stump. It is there, and so that we can sweep on, or we take the sample from there to the lab. I have one of our clients who had her womb removed, and then unfortunately fully removed. Sure, but unfortunately, I think the last time we met was like a year or two ago. She still has some of these changes, the precancer cells changes on the mouth of the stump, and so irrespective of the state, we can still do the screening to ascertain, and then she goes back to do routine screening for like 4 times.
Why the targeted age bracket 9 to 15 for the vaccine?
Great.
Though that is
sure.
a further or more advanced discussion we'll get to. Yeah,
sure. So vaccinations are not for treatment; they are preventive measures. Preventive, primary level prevention, and we are saying that they cause as HPV, human papilloma virus, which is transmitted through sexual activity. And so for the adolescent, or from 9 years, for as long as this child is not sexually exposed, we want to protect the child from before. And so that is why we start at the age of 9 years. And then again, at that point, they are advancing into adolescent age. We don't want to miss them. And so from 9 through to 15 years, for as long as the child is not sexually exposed yet, when they take the vaccine, they enjoy 100% protection from the vaccine, fully protected from the vaccine. But from anytime the woman is sexually exposed, then she needs to do the screening, and then per the outcome of result, the woman can vaccinate. Some people are doing a protocol up to 46 years, like you screen, vaccinate up to age 46. Other people too, especially those in US, because they have done it as a routine level of vaccination for their people, they are looking at even up to age 26, and they see the 26 as a mop-up age that maybe you might have missed it earlier, so want to give you the opportunity to take the vaccine. But for us, since we are now starting, or we started like a few years ago, we're still doing up to age 46, but has to be screened. That notwithstanding, it doesn't mean that if you screen and you vaccinate, it ends there. You do not enjoy 100% protection. You have about 70% protection. So you continue with a routine screening 3 to 5 years.
I love the emphasis on screening before vaccination, because if you have been exposed, then you are not a candidate for vaccination. Right? 055 11 11 997. My WhatsApp is on the blink at the moment. I will rectify that, and then I'll read a couple more. Herpes and HPV.
Great.
Are they the same?
Great. So they aren't the same, but we spoke about the fact that, yes, these are all viruses. And then again, they are sexually transmitted. And so the fact that you have had one thing, it could lead to the other, because they are kind of siblings, to say. And so I even mentioned that for those who have even HIV, they have 6 times chance of developing cervical cancer. And so the fact that you have herpes and it's been treated, for viruses, it is difficult to really say that you have completely dealt with them. Good. That is why I'm sure the doctor mentioned that this is not cured. However, was encouraged, I'm sure the doctor will be encouraging him that we have to ensure that you don't get yourself repeatedly infected to worsen your plight. And so basically with those related infections, that is how they present.
Indeed, any unidentified, untreated sexually transmitted infection multiplies your vulnerability for the others in the family, including HIV. So you should be knowing, you should know what you're doing down there, what you're doing below sea level. It could cost you. This was says, hello, Nortey, good afternoon. So recently, okay, that's I've read already. And then we've done the one about the age for the vaccine.
Yeah.
There was another one.
We have the exposure fingering and the oral sex.
Stephen from, was it Somania? Yeah, he wanted to know about what they call digital stimulation. Right. Okay, you want to say fingering, all right.
So I would say that, currently the issue on board is not about sexual penetration, like penis, vagina penetration. But for as long as you are engaged in any of those activities, where you went, is that area infected with the virus, there's a likelihood that you can transmit or transfer to the other partner. And so be it the oral sex, be it or the digital or any other means of sexual engagement. So it might not necessarily even be like a woman to man, but even the other
even with sex toys.
Thank you.
Right? You're using your gadgets and you're quite happily buzzing and vibrating away. But you are vulnerable.
Highly vulnerable.
Right? So let's get that clear and understood.
Perfectly.
Right? Conclusively.
Perfectly.
Right? It exposes you to the transmission of this virus we're talking about. And indeed, oral sex can expose you to throat, penile, and other cancers, depending on the strain of the virus
that you get exposed to.
Right.
And so that's why for the vaccines, there used to be Cervical, which was only meant for girls. But now currently what is available is the Gardasil, which is against the virus that we have mentioned, and it's for both boys and girls because yes, the throat cancers are there, the penile cancers are there, and it is a man that could get the throat cancer, it is a man that could get the penile cancers. So we just have to modify our way of life and then do the needful.
Great stuff. We're understanding bit by bit. We're breaking down, dissecting cervical cancer. We don't do the awareness that is just t-shirts and brass band. All right, we go deep into it. Phone line 030-221-6541. Joy 99.7 FM. We're live on Facebook and YouTube. My name is Nortey by nature. I'm in the studio with Rose. This is the type of rose without thorns. Okay. Yeah, but she's with the Reproductive Health and Family Planning Center of the Kolebu Teaching Hospital. Do you still do your Wednesday clinics, the well woman clinics?
Sure, but amazingly, sometimes some clients would walk in and they would want to access the service. So you can't help than to see them irrespective of the days that they come. So we still run that clinic and then
from 9 to was it 9?
Currently 9 to 2 p.m.
9 to 2 p.m.
Yes, please. 9 to 2
All
p.m.
women are welcome.
All women. So be it for fertility issues, adolescent reproductive health related, anything.
Great stuff. Back on the ball. Cervical cancer. Some say cervical cancer. I have a caller on the line. Hello. Good afternoon.
Good afternoon.
Good afternoon. Who am I speaking to?
Yeah, Amy from La Paz.
Amy from La Paz. Okay, share with us. Is everything okay? You sound a bit down.
Yes, I think.
All right, share with us.
Please, I'd like to know about whether it's also something connected to cancer. If you have vaginal warts.
Right. Okay. If you have warts, genital warts, is it related to, linked to, correlated with cancer? Right. Do we have another caller? Nope. Okay. So she wants to, Amy in La Paz, she's asking about warts.
Great. So, we mentioned not too long ago that the virus that could cause the cervical cancer, human papilloma virus.
HPV.
The HPV.
Right.
We have the high risk and to cervical cancer, and then the low risk.
Okay.
And so the type 6 and the type 11, they are a type of the low risk, and they cause the genital warts that we have. So, yes, they are in the same class, just that for this one, you don't have a cancer. However, how sure are we that maybe you might not have the other viruses?
Okay.
And so, yes, you could have the warts on the genital area. What we need to do is further do the HPV screening to be sure that whether or not you are at risk of the others, and then we can help you appropriately.
Okay, okay.
So that is about it. It doesn't mean you have cervical cancer,
right?
But that notwithstanding, we need to know your status with it, the other ones. So let's do the screening.
Escalates your risk.
If you have silver
needs, and when Rose says lower risk, we are not saying we're happy with it. Okay, we're not saying all right, relax, it's all right.
Sure,
you have a few warts and life is fine. No.
Because it's highly infectious.
Right.
Highly
you can pass the warts on to somebody else as well, and the strain of the virus. Now, Rose has connected me. Some of our work links us with people who are affected, right? And there's a gentleman who unfortunately lost his wife a couple of years ago to cervical cancer. He's volunteered to share with us. His name is, have I lost the name now? Mr. Finn, right? Okay. He's on the line with me now. Hello, good afternoon.
Good afternoon.
Thanks for joining us, and thanks for agreeing to share a bit of your story. We might have to take the rest later, but let me say belated condolences, though it's a couple of years back to you. I understand you lost your wife who was diagnosed in 2018, and you lost her in 2020. Is that right?
Well, thanks for having me. It's a pleasure to be here this afternoon. I know it's not easy, but then we need to share to also let people understand that a lot of things that goes on that we need to be wary of.
Right.
Not to lose our loved one. To set a record straight, she was diagnosed in 2020. That was March 14th, and she passed on July 10th in 2021.
Wow. Before that, was there anything that you were worried about as a couple?
To be sincere, there wasn't anything there wasn't any sign. There wasn't any symptom showing. It was one time that she went to work, so she came back and was like, she had some kind of blasters after she had her urine. So initially we thought maybe it's an infection. So, and she had knowledge of medication because she used to be a medical cancer assistant.
Okay.
So she went to the pharmacy and got herself some medications. But fast forward, on 13th of March 2020, she went to work, she came back home, and then she started to bleed profusely. So that's when she was sent to Usher Polyclinic, and she was transferred to Kolebu for further treatment.
Right. So it started with identifying blood in her underwear after urinating, and then there was a subsequent more serious bleeding, which led to her being taken to hospital and transferred to Kolebu.
Yes, please.
Right. So she was identified and diagnosed in 2020, and you lost her sadly in 2021.
Yes.
Can you share with us, if you don't mind, when she was diagnosed, did they say anything about cancer at that point?
Okay, so I was home, I think, kind of unfortunate Friday, and the call was placed to me by her mom. But at the time, she was working around Embassy Gardens, around the American Embassy. Right, so she used to stay in Accra. We were in Castle, but the distance was, quite far, and her parents were closer, so she was there. She comes home on weekend. So that Friday, I was expecting her, but then she didn't come. So the mom called me and she was like, she's bleeding, and she was sent to Usher Polyclinic, now Usher Hospital. So it was there that they gave her a transfer to Kolebu because they couldn't stop the bleeding, and they sent her to a bigger facility to take care of them. Yeah, so it was there that I went there the next day, which was the morning. She was admitted. So it was there that she gave me the news herself that when she came, the doctors, checked there, they opened, her under area with a speculum, they checked the cervix, and they saw some growth in there. So they took some samples so we can have a biopsy done. So when I went, the samples were ready for me to go and do the biopsy. For them to say whether or not it was a cervical tumor.
Right. So after the biopsy, it was confirmed that it was cervical cancer.
Yeah, it was diagnosed that it was a cervical tumor. Yeah.
How old was your wife?
She was, at the time, she was 37.
Wow. And so you lost her at what, 38?
Yes, please.
Wow. This is
And unfortunately, when it was diagnosed, I think it was 4 days after we were discharged. But then that was when the lockdown happened. So when the lockdown happened, at the time, the radio oncology department of Kolebu were not accepting referral. They were only dealing with old cases.
Right.
So she couldn't have her treatment on time because of the COVID and the lockdown and all that.
There's a lot we need to share and learn from, and I'm grateful that you joined us. Rose and I will coordinate with you. We'll see how we can better package this story so that our listeners will also understand the need for awareness, screening, early detection.
That's
because
right.
You lost your wife
2 years after marriage.
2 years after marriage.
Yes.
You have no children, right?
No, please.
Wow.
Unfortunately.
I must commend your courage and your willingness to share. I do a lot of work in this space, and very often when we do breast cancer and other things, or even prostate cancer, we forget the surviving partners who have a lot to share. So once again, thank you so much for sharing with us. Next week we'll pick up on this and then use elements of your story, your real life story and an encounter with cervical cancer to educate and empower our listeners. Thanks once again for joining us, sir.
Thank you very much.
Thank you so much. We'll be in touch. Wow.
Thank you, Ike.
Rose.
Yeah.
So, very often when I share or I do programs and we share statistics, statistics don't have names.
Sure.
Right? Sure. I remember there was a gentleman we had for liver cancer.
Wow.
And he shared his, he was also married. He was very, very confident. And sadly, we lost him about a year or so after our program.
Wow.
So thank you for linking us. We'll share some more aspects of this. But coming back, so identification is important.
Very necessary.
Right?
Very necessary.
With or without the risk factors.
Early
identification. Right. Okay. So we'll also, program to look at the different steps of screening. But let's underscore this. When we're screening, we are presumably looking for the condition in people who are presumed to be well.
Perfect.
Right? So screening is actually going through or examining persons who are known to be or presumed to be well, looking out for telltale signs.
Sure.
Okay.
Sure.
So everybody can go, or every woman can and should go for screening.
Exactly.
It's not because you just ticked off two of the risk factors or signs and symptoms that Nortey and Rose shared, right? Because it can be asymptomatic.
Exactly.
Without signs, without warning.
Over a long period.
Right. So screening is non-negotiable.
Perfectly.
Right?
Perfectly. And then that in as much as we talking about the symptoms, I'm just appealing to our audience that don't wait to see any symptom.
Don't wait.
It may be too late by the time you notice it and you come to us.
Okie dokie.
And so the screening is not to test for cancer cells. We are testing for pre-cancer lesions before the cancer sets in.
Right.
This is what we do. So even if you come
and we have the test, the devices, the diagnostic whatevers to identify pre-cancerous cells.
Exactly.
Whoa.
Exactly.
Okay.
So even if you come and there is anything, it still would not be a cancer cells yet.
Right.
It may just be a precancerous that can easily or readily be intervened.
Right.
And so, yes, some people go like, what if I go and they detect anything there?
Right.
What if you don't come and later you have a cancer?
Right.
So it's rather better you come, let's pick something if there should be, and then we can readily help you.
And also, more importantly, the statistics
Very necessary.
are known cases.
Very.
Somebody
very.
has died, passed on. We don't even know
We
it was
don't know
cervical
what killed
cancer.
them, exactly.
You may have a family history, right, that you're not even aware of.
Thank you.
You may be exposed or you may have a high risk profile.
yeah,
But on
yeah.
the outside, we don't see that.
Perfect.
So screening is
That's very
non-negotiable.
paramount. Very key. Very
Right?
key.
Of course, it has to
key.
be paid for, but it's non-negotiable.
Yeah. And it's more expensive to treat or manage cervical cancer.
You don't want to get there.
You wouldn't want to.
Right.
You wouldn't want to.
Whoa.
Because if we had to call in other like caregivers, supporters to share their experiences, they wish they never had a close relative
Right.
who is suffering it.
Right.
And so if you can decide, it should be a conscious effort,
Right.
that this is what I need to do for myself. And interestingly, it is not an annual thing.
Yeah.
If you do the test, you do the pap smear, it comes out to be normal. The routine screening is 2 to 3 years.
Right.
If you do the HPV DNA testing, routine screening is 3 to 5 years.
Okay.
And so you can do the
Well
result is
worth
fine.
the money. Well
Very,
worth the money.
very, very,
Hi,
very.
Nortey. I had a pap smear screening about 4 years ago. It was negative. Amen. Please, how often do we have this screening or this one says HPV screening,
Okay,
right?
right.
But she starts with the pap smear,
Good.
right?
Good.
And let me read a couple more. They were
Okay.
piling up when the gentleman was on the line. Good afternoon, Nortey. Please, can I get the audio of this education? Yes, you can. I think it's available. We also share our podcasts as well. With my, what is it? To share with my to go and the test. She's a very difficult, okay, I think he's referring to his partner. She's a very difficult woman, and I need the audio to know the severity, for her to know that or appreciate the severity of this situation. Thanks for the education. Ernest in Tayman. All right. We do have, we are live on Facebook and YouTube. And after the program, you can access the audio for the program as well. Ernest needs evidence to convince his partner, right, to test. Good afternoon, Nortey. How are you and your guests? Thanks for the educative programs you've been giving to us every Sunday. God bless you all. Now, my point is that I would like to know the institution that is supposed to provide the vaccine that could be used to prevent the disease for the age between 9 to 14. Secondly, are they doing for the children in Ghana, as said by someone from the U.S.? This came up some time back. A program was launched.
Exactly.
Right? So,
Sure.
Rose.
Okay, so I really knew we'll definitely get
We'll
there.
get there, yeah.
I know, right? So, starting from the issue of the vaccination, yes, in some countries it's part of their expanded immunization programs, and like we know, a lot of things are highly capital intensive,
Right.
and donor supported, and so I know there is quite an extent of work ongoing
To make
to
it
ensure
widely
that
accessible.
yes, widely accessible. It would be on the expanded immunization program for Ghana,
Right.
but I cannot really say how soon it's going to be.
Yeah.
And so then quite a number of the private or public institutions like Kolebu Reproductive Health Center, I know there are other private areas, so they have the vaccines available.
Okay.
That you can, just that it comes with a fee.
Yeah.
And so it ranges between 750 and then 2,500 depending
Right.
on the type.
Depending
They
on the
got to sell
type,
4
yeah.
or they got to sell 9.
Right.
And so a lot of the private institutions, trust hospitals and the others, they all have their vaccine.
Okay.
And what we're saying is, if you have children, you know that yes, they are in their early adolescence,
Right.
late adolescence. It is better
They are
with
good candidates
exactly
for
for the
vaccination.
vaccination.
Right.
It's better we vaccinate them than
Okay.
to wait. And then with the HPV, our client who mentioned she
Yeah.
screened 4 years
Yeah.
ago.
The pap smear.
Yeah.
Yeah.
When you do that normal pap smear, the routine screening is between 2 to 3 years. And so by the 3rd year, you should go again for a routine screening. If everything was okay at the time, but if maybe there was some maybe abnormalities that were pegged, then your structure for the screening may change a bit.
Right.
Either will go 6 months and they will ask you to come a year, but that is individualized depending on the outcome.
Okay.
But since hers was normal, with the HPV DNA, if everything is fine, you do routine screening every 3 to 5 yearly currently.
Okay.
Yeah.
Right. Great stuff. We're out of time, but hey, once I put my fangs, my teeth, my sharp teeth into my guests or into a topic, rest assured, we will deal with it. So Rose is not discharged. She's still on admission on Ultimate Health. We've got a lot to unpack and unload because when I look at the numbers,
it's overwhelming.
It's overwhelming.
Yeah.
Hi Nortey, when will you guys talk about umbilical cyst? This is Edwin in Dansoman. We'll put it on the radar. You can't believe the number of things I have on my radar.
I know, right?
And it's a weekly program, so I do a lot of coin tossing to make sure the focus is there. But Rose, thank you so much. We've laid a foundation.
Sure.
There's a lot more people need to know and empower themselves with when it comes to cervical cancer. There's a lot more data and statistics out there that I will present to you next week. The pink sheet.
It is important.
The pink sheet when
so
it comes to this cancer. We'll talk about those things and then we'll share a lot more with the gentleman, Mr. Finn, who shared with us. In fact, some of the strongest,
I know, right,
effective advocates I've worked with are people who've borne the brunt, even the ultimate when it comes to the things we discuss so lightly sometimes in the studio. So
you're right.
Join me to thank this gentleman for sharing a piece of his story. I'm sure he's still trying to cope. He sounds very, very, very positive, but he does want to share. So we'll harness that again on your behalf next week on Ultimate Health Joy 99.7 FM 205. Make a date. Don't be late because we get a lot of serious stuff done. Rose, so you've been committed.
I know, right?
Admitted.
I don't have no say.
Abeku will give you a lovely side word. Side word, Ultimate Health. We'll give you a lovely side word. Your own TV and all those things.
Know, right?
But we hope we can get you next week.
Sure.
Thank you so much.
Anything cervical cancer, it actually my heart beat because I'm not excited when I had to see healthy cervix and then it is not. When it can be intervened. And so just before we go over, I think I would appeal with the audience once again. If your husband, a brother, you have mothers, you have sisters, you have friends who are ladies, you have us around you. Please just commit a bit of the cities to help us to go and screen. Sometimes it is just a morale you need to give us. And to reproductive health Kolibu, we're starting the screening. It's a high level screening from 5th to 30th of April, 5th February to 30th of April. We're doing a highly discounted. So the PAP going for 100 Ghana instead of 170.
Okay.
And then the combined testing, HPV and the pap smear as well, going for 220 instead of 320.
Lovely,
Please
great stuff.
Don't miss this.
We are blessed to know this. And maybe you might not be a woman, or maybe you've had it done already. You might want to sponsor somebody's screening.
Exactly. God bless you for that.
Start the year with some
giveaway.
Give something. Give. Right? We'll see how we can do that. Right? Thank you so much. Thank you, Abeku. I've gone a
few. We are very mobile too.
We've done a few minutes over time, but all for good purpose. They can stay on Joy 99.7 FM. My name is Nortey by Nature, produced by Abeku San Kofi. He's been very busy offshore. But I won't mind him. But he gets it done for me each and every Sunday. Let me also send a shout out to Dr. Henry Nagai. He was supposed to be with us. We wanted to look at another slice of the cervical cancer story, which is cervical cancer in persons living with HIV, right? But he had an unfortunate family emergency, and so he couldn't be with us. And I yanked Rose in at very last minute. So, Henry, I hope it's going well. Thank you. We'll get to do that very, very soon. Stick and stay on Joy 99.7 FM. I'm still loving and learning this song. I'll bow out with that and Abeku will take over.